Hello friends, I am Dr. Mahesh Shah, cardiologist from Mumbai. What is the best way to blood pressure measurement? Whether is it at your home or is it with your doctor in his office? Well, studies have clearly shown that 1 in 3, 33% of patients, when the blood pressure is measured in the clinic, it's artificially elevated. We call it white coat hypertension or white coat effect. So best way to measure blood pressure is at home with your electronic machine. But you need to keep a few technical parameters. They are very simple and easy ones, but you need to keep them in mind in order to measure your blood pressure accurately. The true blood pressure, which reflects on your risk for heart disease, etc., which needs to be controlled and corrected. You should buy a good reputed brand blood pressure machine. The blood pressure cuff should be appropriate for your arm size. If you are obese, then you need a larger cuff. There is usually a mention on the cuff for what arm circumference or perimeter that cuff is appropriate. Make it a point to check it. An undersized cuff can easily add 10 millimeter artificially to the real value. The blood pressure cuff should be applied on a bare arm. If it is applied on a clothing, it will elevate the blood pressure artificially. You should take at least a couple of minutes of rest before you check your blood pressure. There should not be any unusual activity, like you should not be talking or communicating with anyone. It can raise blood pressure by 5 to 10. Your back muscles and leg muscles should be completely at rest. So you need to have a chair with a backrest. Your back should be supported. Your legs should be supported on the ground. If they do not reach the ground, put some box or something on which your legs are resting. You should not be crossing your leg. Any of these muscle activity in terms of talking, in terms of unsupported back, unsupported legs, crossed legs, would add 5 to 10 millimeter of mercury to blood pressure. If there is a recent tea, coffee, or cola intake or a large meal, again your blood pressure gets elevated. That's not the blood pressure we want to measure. So avoid measuring for an hour or two after a meal. After a significant amount of alcohol consumption, again blood pressure will drop for an hour or so. So avoid that time. The atmospheric temperature and noise level should not be excessively elevated, because that also would affect your blood pressure. If you take 2 or 3 blood pressure measurements and first one is very high, ignore the first value and take the average of 2 values. If you are taking blood pressure for the first time in your life, make it a point to measure it in both the upper limbs. And if the difference between 2 limbs is more than 10 millimeter of mercury, it makes sense to permanently use the arm in which the blood pressure was on higher side. If you keep these few simple tricks in mind, you can measure your blood pressure accurately, and that will help your doctor to take more accurate decisions about your blood pressure, starting treatment or titrating the therapy. Blood pressure, right karo.